some interesting stats about insomnia. 850 million people worldwide suffer from chronic insomnia. And then 8% of them have severe insomnia where they don't sleep at all for weeks on end. And another stat that was interesting is women are twice as much inclined to get insomnia than men. So we as women get more affected by it. So today I'm going to share with you how we can address chronic insomnia with Chinese medicine and acupuncture. We're going to look at the most common patterns, acupuncture points, formulas. We're also going to talk about diet, sleep hygienes, supplement, and stay till the end because I'm going to have also a couple of hacks that can help our patients when we're not really sure of the diagnosis. And they work really well in clinic because I've done this since 2003. So are you ready? Let's do this. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Let's go. Before we start talking about TCM and what it can do for insomnia, let's talk about the Western view. First of all, what qualifies as insomnia? We understand that sometimes we don't sleep well. I know when I travel and I have to take a plane at 7 a.m. the next morning, I'm not going to sleep well because I got to make sure I wake up and not miss the plane. Or if I'm excited about something, definitely I don't sleep well. Or if you're a student, you know the night before exams, usually we don't sleep very well, right? Or if you have an event that's coming up and you're anxious about it, that might create some acute insomnia. However, to qualify as chronic insomnia, it has to be at least 3 times a week where the person does not sleep well, wakes up a lot, and has a disturbed sleep for at least a month. Now we're talking about chronic insomnia. Now, for some people, that could be 3 months, 6 months, a year, or years. I've had patients saying to me, I haven't slept well in years. They're so used to not sleeping well, it's their new normal. We want to really change that and educate patients that it's so important to sleep to recover from the day's activity and to be able to continue to enjoy life and not be affected by the missing link in our health. When it comes to Western medicine, treatments are usually medication, over-the-counter, or prescribed. Antidepressant, anti-anxiety medication often are prescribed as well. Sometimes doctors may say melatonin is a good idea, take some. Now, it's really interesting because melatonin doesn't work for everyone. Melatonin, I found, can work really well when we're jet lagged. If I go to Europe and I'm 9 hours off my regular time and I'm not really sleepy when it's time to go to bed, or I fall asleep at 5 p.m. and then I wake up at 2 a.m., that doesn't work, right? So usually taking a few drops of melatonin for the first 3 days that we are in a different time zone works really well for us. I just listened to a podcast recently on the Diary of CEO, and the guest there is a science-based sleep specialist. And I will have the link for you below because I absolutely love this episode. Everything he was saying was very connected to Chinese medicine. He was saying that the best quality sleep is between 11 p.m. and 6 a.m. That's exactly what TCM says as well. He was also talking about the quality of sleep, the quantity of sleep, and something that was very interesting. He said, a lot of people don't sleep enough during the week because they have so many things to do. And then they say, I'll catch up on the weekend. And we think that we can catch up on the weekend. And he said that doesn't work. They did a lot of study on this, and you cannot catch up, meaning that if you sleep 10 hours 2 nights on the weekend, but you sleep 5 hours or 4 hours during the week, it is not going to be beneficial. Interesting, right? So I'll have the link for you below. And it actually gave me the idea to create this content for you on insomnia. What are the common contributors to not sleeping well? Stress, pain, medication, caffeine, alcohol, diet, sleep apnea, of course, restless leg syndrome, menopause for a lot of women, having night sweats and hot flashes will wake them up, of course, depression, anxiety, Also, for people that have a poor sleep environment. If you sleep next to someone that snores really loud, or you have a room that's too hot or too bright because you live in an apartment that has a lot of light, or like a lot of people, you are on your device just before going to sleep, and that blue light is not the best because it creates havoc on the circadian rhythm. Your body needs to know that it's nighttime. Another risk factor is shift workers. I have a lot of nurses and firemen that I see as patients, and they all have health issues because the circadian rhythm is all out of whack. They work 12 hours at night for 3 days in a row, and then they try to get back to a normal rhythm by not sleeping during the day, but sleeping at night. And it goes back and forth like this, and it's so disruptive to the whole entire health. So that is a big risk factor for insomnia because it's very hard for the body to go to bed during the daytime. Even though you may put a mask on your face, the body knows outside it is bright. And there's a couple of more like family history or genetics that can contribute to insomnia. And of course, as we age, people have tendency to sleep less and less. I know when people turn 50, 60, they're like, oh, now I only sleep for 6 hours, and 70, you sleep less. If they have urinary incontinence or issue with needing to get up at night to urinate, then their sleep is interrupted, and then they have chronic insomnia because they're up and down all night. So lots of contributors, lots of risk factors can lead to insomnia. I want to share a quick story with you. When I was a TCM student, in my class, there was this student that had insomnia. And we became friends and we started talking, and suddenly he's telling me he doesn't sleep at all. And I couldn't quite compute with that. What do you mean you don't sleep at all? He's like, I haven't slept in a full night's sleep in months, and I don't sleep at all. And I'm like, how do you function? How do you study? How do you survive if you don't sleep at all? And he's like, I lay there for a few hours and then I just read and do other things and I study. So it was really good because he studied all night, but he couldn't sleep. And then I said, well, why don't we go to the students' clinic and see what happens? And my favorite teacher gave him herbs, and we did acupuncture on him. He had heart fire, like really a lot of heart fire. And he was always walking fast, talking fast, very, very hyper kind of personality. So she gave him herbs that are very grounding and have animal parts in them, like oyster shell. And then he did acupuncture 3 times a week. And within 7 weeks, he was sleeping a full night. His anxiety had come down because he had really high anxiety. It was fantastic to see. I loved it. And that teacher was one of my favorite ones because every time she treated someone, they got better. So I always listened and paid attention to everything she shared because she totally rocked it. Now let's talk about the consequences, right? Because the idea is it's not just that you're going to get tired and look for caffeine and look to have sugar or food that is going to keep you awake from being fatigued all day. It's also the fact that it's going to deplete the immune system, so the person's going to get sick more. And if you look at the 5-element theory, it makes sense because when we look at the sequence where fire controls metal, then if there is no sleep, it is going to overpower the immune system or metal or the lung and large intestine, and the immune system is going to get depleted. The consequences are also it's going to affect the cardiovascular system. It increased the risk of stroke, of heart attack, of high blood pressure, mood disorders, depression, anxiety. It affects so many systems. This is why I feel that Chinese medicine is so good with mental health, and insomnia is one of the things that we can treat. And it's not just about Heart 7, although Heart 7 is one of the best points for insomnia. Now, we're going to look at the TCM views. Let's start with ear acupuncture, one of my favorite microsystems. When it comes to insomnia, we want to do Shenmen, sympathetic, subcortex. And then we're going to do heart, spleen, liver, and kidney. Now, you don't have to do them all. If the person was anxious, I would do more heart and spleen, forget the kidney and the liver. Definitely do Shenmen, sympathetic, and subcortex. If the person was more stressed, then I would do more liver, heart. And if the person had phobia or massive anxiety for years, maybe heart and kidney, if they're going through menopause, for example, would be a good combination. Does that make sense? So you don't have to do them all, but at least 5 points would work really well. Now let's look at the most common patterns when it comes to insomnia. One that I see the most in clinical practice is heart and spleen, Qi, and blood deficiency. The main symptoms is the person cannot fall asleep. It takes them 2 to 3 hours to fall asleep. They overthink, they're anxious. Once they fall asleep, they usually stay asleep, but sometimes they're easily awakened if there's a little noise or something happening. They worry a lot, of course. They have palpitation, poor memory, and this is a poor memory where you read the same thing over and over and over, and you can't remember what you read. Poor appetite, meaning that they're not hungry in the morning, but they get hungry as the day goes, and they eat at irregular meals. They can have loose stools if the spleen Qi deficiency is very pronounced, but they could also have constipation if there's more blood deficiency. They're definitely fatigued, and they have pale face, pale lips, and pale tongue, and a weak pulse or a weak choppy pulse if there's more blood deficiency versus Qi deficiency. The best formula for this is Gui Pi Tong, and the best points to nourish Qi and blood of the spleen and heart is bladder 17, bladder 15, bladder 20, backshoe points of heart and spleen, spleen 6, of course, stomach 36. I love stomach 36 for this because it's one of the only points that tonify both Qi and blood. Of course, we want to do heart 7. We can add up Anmian because if we're doing a back treatment, that would be a perfect idea as well. The next one is liver blood and liver yin deficiency. So this person is going to wake up at liver time, meaning between 1 and 3 a.m. They're going to be very restless, very agitated. They're going to have maybe night sweat. This is when the menopausal, perimenopausal starts to happen. They're going to fall back asleep, but then wake up a few more times and fall back asleep. They'll have usually pale nails, but they may have red cheeks because of the yin deficiency. If the yin deficiency is not super pronounced, then they may not have it yet. They will have dry mouth, specifically at night. They'll be very irritable, very stressed. The tongue's going to be pale with red sides, and it's going to be dry because there's yin deficiency and blood deficiency. The pulse may be choppy, thin, rapid. The best formula for this is Swanzauer tongue. And the acupuncture point would be, again, we could do heart 7, we could still do Anmian, and then we want to do bladder 47, bladder 18, bladder 17, spleen 6 again. We could still do stomach 36 if we want to, but if we do a back treatment, it's really hard to do all of those. So we're going to do liver 8 to tonify liver blood, and of course kidney 3 or kidney 6 to tonify yin deficiency. However, you don't have to put kidney 3 or kidney 6 because spleen 6 will address the blood and the yin deficiency. So if you want less points, which is always my way of treating, then you don't have to do that point. Make sense? When it comes to liver fire versus liver yang rising, this always affects the patient as well. Both are going to wake up between 1 and 3 a.m. And then, if it's liver yang rising, the patient's going to fall back asleep eventually. If it's liver fire, they will not fall back asleep at all. So that's the difference there, right? And then, of course, they're both going to be stressed, very irritable. With the liver fire, it's going to come to anger, like worse than liver yang rising. They're both going to sigh a lot, maybe have red eyes, specifically bloodshot eyes if they have insomnia for a long time. They're going to have temporal headaches, maybe dizziness. If it's liver yang rising, they'll have a red sides of the tongue. If it's liver fire, they're going to have red tongue with a yellow coat and very dry. The pulse is going to be wiry, rapid. So they're very close to each other. Liver fire might create some high blood pressure, while liver yang rising, often comes back down if there's less stress, while liver fire is kind of like a permanent chronic issues. The best formula for liver fire is Longdon Shakedown tongue. This is very cold, so I wouldn't give this for a long time. We want to bring that liver fire, liver yang down. So we still going to do heart 7, Anmian, but now we can do liver 3, liver 2. Liver 2 brings liver yang down. We could do kidney 1 to bring the fire down, specifically if there was high blood pressure. We can do gallbladder 43 for temporal headaches, specifically due to excess heat or excess fire. We could do gallbladder 20 if there was dizziness or high blood pressure. Again, you're going to have to decide if you want to do a front treatment or a back treatment. This is just the guide, right? Have you signed up to my weekly newsletter yet? It's completely free and I share exclusive content I don't share anywhere else. I do case studies, I compare points, and I provide so much value. If you're not on it yet, the link is below for you. What are you waiting for? One that's interesting is stomach food stagnation. This is for people that constantly overeat late at night. And so that creates some issue because we're not supposed to eat before we go to bed, right? And they'll have big meals late at night. I have patients that basically don't eat all day and have a massive meal at 8 p.m. and continue to watch TV and eat popcorn or chips at 10 p.m. So now we have insomnia with indigestion. So the person's going to wake up in the night with heartburn, pain in the stomach area, fullness, feeling bloating, nauseated even, and having acid reflux. That makes sense, right? So the cause here is easy to figure out and it's easy to prevent by educating the patients that they need to stop eating by 7 p.m. if they go to bed, let's say at 10, and not a heavy meal. Every time we have a big dinner or Christmas dinner, we feel like, oh, that was too much. And it's hard to sleep, right? Makes sense? That's once in a while. But some people do this on a chronic basis every day. The tongue is going to have a thick, greasy coat and the pulse is going to be slippery. A really easy formula is Bauer-1. Bauer-1 is kind of like the digestive enzymes formula. So it helps in digestion. But again, the best thing to do is not to eat big meals late at night. We can do points like REN 10, REN 12, of course, to kind of help the stomach. Liver 13 to help the stomach and the spleen, because that's the front move point of the spleen. Stomach 36, spleen 6, pericardium 6 for the nausea, the heartburn. We could do REN 17 because it's also for the heartburn, the acid reflux. But I would reinforce again that we just need to change the lifestyle habits. Another one that I see a lot in practice is heart fire. Now, this is the one that I was talking about with the students in my class that had heart fire. He had insomnia where he didn't sleep at all. This can happen a lot with people with schizophrenia or bipolar. When they are in a manic state, they don't sleep at all. So they're so agitated. Their mind is agitated. They have a restless body. They're thirsty for cold drink, of course. They feel really hot in general. They can also have canker sores in the mouth or on the tongue. They have a really red tongue with a redder tip and a full rapid pulse. They're very restless. They walk fast, they talk fast, just like I described earlier with the students that was in my class. Now, there's a formula for this called Dai-Che-San. We can add up Huan Lian, it's a single herb, to really calm the mind. We want to do heart 7 and An Mian, but now we want to bring that heart fire down. So heart 8 is one of the best points for that. Pericardium 9, we could bleed pericardium 9 to bring that fire down. Stomach 44, the best point to clear fire in general. And we could do any points to calm that mind. We could also do kidney 1. There are a lot more patterns, but I just wanted to give you the common one that we see the most in practice. If you want all the patterns and everything that I share when it comes to insomnia, you can find all this in my blue book, TCM Treatment Made Easy. It covers over 160 syndromes, just like I did with the insomnia here, with ear acupuncture, acupuncture point formula, diet, and so much more. If you don't have your copy yet, it ships all over the world. Or if you'd rather have the PDF version, it can be downloaded on all your devices and it comes with video links to complement it. The link is below for you. Now let's talk about TCM nutrition. Of course, we can recommend food specific to each patient's TCM pattern of diagnosis, but there are rules that are going to apply to everyone. Number 1, no caffeine or sugar after 2 p.m. because that will affect the sleep. 2, avoiding big meals at night and stopping to eat 3 hours before sleep. 3, no alcohol, specifically for patients with liver yang rising or liver fire, even for the yin deficiency, perimenopause, menopausal woman, because it is going to affect the sleep. We can also recommend to increase the magnesium-rich food like nuts and seeds or tryptophan sources like turkey and eggs. When it comes to supplement, magnesium glycinate is the best one to kind of calm the mind. So that's a good one to take. L-theanine has also been shown to help when it comes to sleep. And then, of course, you can recommend teas like valerian root, chamomile, lavender. For some people that helps. I have to share something with you. I never liked the taste of chamomile. I don't like it. I don't know why people love to drink that. It tastes funny to me for some reason. But what's interesting about chamomile, side note, is that it's from the same family of echinacea or ragweed. So if the patient has ragweed allergies, then it's going to create more issue because chamomile and echinacea also are from the same family that creates hay fever. Little side note that, herbs are not without side effects. And before I finish with my last acupuncture hack to help your patients sleep better, even if you're not sure of your diagnosis, let's talk about sleep hygiene recommendation. First, consistent sleep and wake up schedule, even on the weekends, going to bed every day at the same time and waking up at the same time. Second, creating a routine at night to wind down. So 30 to 60 minutes before bed, doing something that's going to calm the mind. Not streaming some true crime or gory show. That is a big no. Taking an Epsom salt bath would be great, or a nice warm shower before going to bed. Reading something that is very calming, maybe meditating, or doing some light stretches. 3, limiting the blue light exposure, meaning read a real book, don't be on your phone. What I recommend to patients is take that phone and put it away from your bed, maybe in another room. I know that's really hard for people. And have an alarm, a real alarm like the old time to wake you up if you need to. But if the phone is right there, what do people do? It's the last thing they do before they go to bed, and it's the first thing they do when they wake up. That's another thing. It's really important in the morning when we wake up to allow the eyes to adjust to the light, the natural light, not the phone light. So it should not be the first thing we look at in the morning because that will affect the sleep later on. I love a room that's cool at night. I have my big duvet, I'm in Canada, all the way up, but my room is cool. And often we have the window open so you can breathe fresh air and yet you are cozy inside your blanket. That for me is the best sleep. Make sure you tell your patients that insomnia is not just an inconvenience. It's actually a really serious issue that can affect patient and their health entirely. We want to also set expectation that if they had insomnia for 3-4 years, one session's probably not going to do it. We're going to have to be consistent. And so this is why we're going to encourage to say we're working as a team. You do your part and I'll do mine. Meaning we want to make sure that patients understand that the education we're giving them about sleep rituals should be followed the best they can in order to support the treatment we do. We work as a team, not us doing the work and them expecting results. Make sense? Now let's talk about the little hacks we can use if we're not sure of our diagnosis in TCM. First of all, the Buddha's triangle. The Buddha's triangle is long 9, heart 7, and pericardium 6, forming a triangle on the wrist. And that is really useful for insomnia, depression, anxiety. Often people ask me, do you do it bilaterally? I usually do if that's the treatment purpose. If the treatment purpose is the person's coming for fertility and they don't sleep well, sleep is important for the reproductive system as well. But if I focus on fertility, I might just do the Buddha's triangle on one side and I will pair it with 3 points on the ankle, which would be spleen 6, kidney 6, and kidney 3. That is a really good combination for reproductive system and insomnia. The second one I wanted to say, if someone comes in and they have cortisol level issue, which means that they are really tired in the morning, so their cortisol level is way down, and they are really wired at night, their cortisol level is way up. So patients will say, I'm exhausted physically, I go to bed and I can't fall asleep because my mind is active. So this is a cortisol level issue where it's too low in the morning and too high in the evening. We can do points to put the patient in a parasympathetic state, of course, but what we want to do is do 20, the highest point on the body, combined with the lowest point, which is kidney 1. So kidney 1 is going to bring that mind chatter in the head down, and do 20 is going to lift the energy, but still not lift the mind. So do 20 kidney 1, great combo when the person is really fatigued but cannot fall asleep. And the last one is combining An-Mien, the extra point that's best for insomnia, Heart 7, the best point for insomnia, with Stomach 40, when the person gets waken up by a lot of dreams. Their mind is active, too many dreams, maybe nightmares, maybe not, but the dreams are really disturbing the sleep. So An-Mien, Heart 7, and Stomach 40 is a great combo when there is dream-disturbed sleep. As I mentioned when we first started, insomnia affects millions of people. And sometimes patients come and see us not necessarily for insomnia, but we discover when we ask our questions that they don't sleep well for years. So now we can educate them and we can also support them and help them sleep better. So I hope you have a beautiful night's sleep tonight and you wake up rested. If not, you can also massage Heart 7 before you go to bed just to calm the mind. And have a fantastic day. Keep rocking it using TCM because after all, acupuncture rocks.